afternoon, everybody. This is the Board of Health meeting, March 11th, 2025. And we are starting, I think, right on time, actually, today, 3:45. Welcome, everybody. So, the first order to address is the approval of the agenda. We have a motion to do so. We will proceed along our agenda, and next item will be, hopefully everybody, call for the vote. All in favor of approving the agenda? Aye. Any opposed? All right, approved. So now we'll move on to address the meeting minutes from last meeting. Any questions or comments?
I'll move to approve the minutes.
Second, anybody?
Second.
All right, all in favor of approving the meeting minutes from last meeting?
Aye.
All right, now we get to do the good stuff. So do you wanna do start with the proclamation?
The first proclamation is on National Developmental Disabilities Awareness Month, and I will call up Mark Moffat, who is our Social Services Program Manager, and Pam Smith, who is a client. I'll have you come sit right up here to give a brief description of some of the programming that we do in the department and how it is affecting the community.
Oh, excuse me.
Good afternoon, everybody. Mark Moffat, Public Health and Social Services, and this is my friend Pam Smelt. We're going to talk a little bit about developmental disabilities and what we do for the county. I think everybody's heard my brief, maybe recently or maybe it was a year or two ago. So I'll go over it really quickly, and if you have questions, please feel free to interrupt. So at Public Health, we have our big program is employment. So we help people with developmental disabilities find employment. We don't do it. We contract with five agencies in the county: Morningside, Bodice, Center Force, Exceptional Foresters, and CareerQuest. And they actually do the coaching. They coach the client at work to make sure they know how to do their job. They help them find the job, and they explore their interests so we have a good job match. We also do community inclusion. And community inclusion is anything outside of work, because we know work is not our lives. We want to enjoy it as well. And so we can help them with volunteer activities, hobbies, right? Activities, things like that. And those are our two big programs. And I know all of you are informed, so I want to make sure this is a point that I make today. We've all heard about Medicaid potential cuts. This isn't just about healthcare, but we get a 50% match in the programs that we support people with IDD. And so if those funds go away or get diminished, that's going to affect the workforce for our folks. And we hate to see that. So there are a lot of county councils that are forming letters to state ledge to support the Medicaid in how we're doing it. So I just want you to make sure that you're aware that it affects more than just the elderly, low income, and Medicare. We also have specialized recreation, and Pam participates in that a lot.
Yes.
So we do bowling. Can you name some of those?
Yeah, the movies.
We have a movie night.
And dinner around the world.
Oh, dinner around the world.
Yeah.
So we'll go around the county. We try to hit all points in the county, find different restaurants, and plan those dinner nights.
And I gave Tracy to my.
Yeah. Can you tell me what?
One of them were like Mr. Doug's in Yum. It's a family restaurant.
Oh, okay. Because you live in Yum.
Yeah.
So you know that part of the county a lot better than I do. So those are some of the activities that we do. We put on more than 160 activities each year. And like I said, Pam does a lot. We have swimming, bowling night. We have our themed dances once a month. That's popular. And then, of course, karaoke.
Yeah, karaoke.
Everybody loves karaoke. They talked me into that a year ago, my first karaoke ever again. But everybody else knows.
What song did you sing?
And I let them pick it. I thought it was going to be something, like, what was it? Well, I thought you guys could do something really silly, but it was Grandma got run over by a train. I was good with that. And and going in about 40 minutes, we have our annual resource fair. It's over at ESD 113. So if you guys have time after this, it's going to run until 7:30. And so we have a lot of the providers and things that happen in the community are going to be there for people to find out. It's more informational than anything else. The one program that I would really like to highlight today is called Project Safer. And it's one that we are bringing to the county. It's Clallam County, I think, is the first county to do it in the state. And it's to connect our first responders with people with intellectual and developmental disabilities. Because we don't want that first contact to be something that is critical, whether it's emergency or, medical or law enforcement. We want it to be, law enforcement is really good at mental health crisis, but that's much different than developmental disabilities. And so we want to bring both of these folks together. And we're doing that in May. I will get the details to you all, so hopefully some of you can attend. The sheriff is going to be our opening speaker. It's going to be we have a facilitator that's going to kind of work with the groups and find solutions to problems. So we're really looking forward to that. So that's my program. If there's any questions, let me know. I do want to talk to Pam though. So I'm going to kind of zone you guys out, and I just want to talk to Pam for a little bit.
Okay.
So Pam,
Yes.
do you have a job?
I do.
Where do you work?
Goodwill,
How long have you worked there?
Oh, I know. But they transfer me from the Lacey one to the young one.
Oh, why'd you transfer?
Cause somebody didn't want to get the COVID shot. I guess I'm not really sure, but they didn't want her to work there anymore for some reason.
Okay.
My friend Jessica, I don't know if you know Jessica.
I don't know Jessica, but it worked out for you too.
Yeah,
Right?
it worked out for me.
Because how far do you live from there?
Not that, like 5 to 10 minutes.
Yeah.
Maybe.
And to Lacey, it was half hour.
Well, no, I did live in Lacey
Oh, at the time?
at the time,
I see.
but they switched me from the Lacey one to the young one.
And what do you do at Goodwill?
I not sort. I pull the color of the day, whatever the color of the day is. Like this week is purple, so I take it off the wall, and it goes to outlet to a different store
I see.
if it doesn't sell.
So things don't sell well,
Yeah,
you pull off. Oh, great.
and I do the children's. I did the children's.
The children's section?
Yes.
Okay.
Yes.
Okay. And so what else do you do? What do you like doing for fun?
I like the bowl.
Is
I'm
that with
doing
Special Rec?
Yes.
Yeah.
I go to movies, but I don't do the Lacey one anymore because they get me. If they can change the hours of the movies, I can do it like during the day, but it seems like it's at nighttime more.
Yeah.
Then that gets me home too late.
No.
Then I have to work the next morning.
Yeah. Yeah, the challenge is,
Yeah.
so if we did a movie night in Yelm, would that work out for you?
Yes,
Yeah.
that would be. I think I did tell Tracy about that.
You did?
one,
Okay, good.
But she hasn't responded to me yet about it.
So you used to go at night?
Used to, but it got too much.
Oh, okay. Okay. How do you get around?
Dial lift.
And how's that work out for you?
Good. They used to never call me the 15 minutes.
Mhm.
And when they show up at the house, they call me when they're there now.
Oh, good. So you don't have to keep looking out your window?
Well, I still have to look out the window. But it works out better. I think it works better for me.
Okay. And that's how you got here today? You got here right on time?
Yeah. was supposed to have another pickup. They add,
Oh, another stop.
yes.
Yeah.
But the dispatcher called and told them to just give it to another driver.
Oh, good. Well, you were early. I didn't have anything for you to drink, but we'll go get something to drink after this.
Okay, that's fine.
Is there anything else you'd like anybody to know
Um,
about your life, your work, anything?
I like my work, and I only work 2 days a week, Mondays and Wednesdays, and from 10 to 12. Good, that's a good shift for me. I like to go out to restaurants. And I like to stay active.
Thanks, Pam. And that's what we try to do with our programs. We keep them active with work that they enjoy, that's productive.
I enjoy my work.
Yeah. And other activities. So that's what we want to keep doing. Again, there's always change, and that's okay, but let's change for the better, right? So that's all I have for you guys today.
Shall we read the proclamation? All right, are you guys okay if we start over with Commissioner Grant to kind of come this way, or is that too much? I'll make sure we get time for everybody to pull it up.
Got it. And glasses.
Sorry to put you on the
All right.
pressure there.
All right, proclamation for National Developmental Disabilities Awareness Month. Whereas Thurston County Public Health and Social Services is involved in advocating for programs that promote positive system changes, allowing persons with developmental disabilities to achieve optimum independence, and promoting innovative programs and practices that improve the quality of life for people with disabilities. And
whereas Thurston County encourages all citizens to actively participate in events and appropriately recognize and celebrate Washington's diverse population, including persons with developmental disabilities. And
whereas in Washington, approximately 83,000 adults and children have developmental disabilities, and a majority of these individuals are primarily or solely supported throughout their lifespan by their families. And
whereas people with developmental disabilities share with all Washingtonians a desire to achieve personal success through education, meaningful work, and family and community ties. And
whereas Thurston County is committed to recognizing that every person, regardless of perceived ability, has valuable strengths, infinite capacity to learn and make decisions, and the capability to make important contributions to their communities if given opportunities to do so. And
whereas we acknowledge Washington State's leadership in public policy, accomplishments concerning persons with disabilities in employment and their quality of life, and in identifying improvements to public policy that facilitate full inclusion of Washington citizens with developmental disabilities and their families. And
whereas Washington State leads the nation with 87% of individuals with developmental disabilities participating in county-managed integrated employment and day services compared to 24% nationally.
Now therefore be it resolved, the Thurston County Board of Health hereby proclaims March 2025 as Developmental Disabilities Awareness Month in Thurston County, and calls upon all citizens, communities, state agencies, and elected leaders to increase public awareness of the needs and potential of individuals with developmental disabilities, and to recognize that persons with developmental disabilities are vital and vibrant members of our communities. Adopted this 11th day of March 2025.
And we can go take a picture.
Take a picture.
Here's this one too. I was just reading it.
Yeah.
let's go ahead.
right, our next proclamation is on International Transgender Day of Visibility. And I'd like to introduce Lucas and Quinn, who will also introduce themselves and give a few words about this important proclamation.
Ladies and gentlemen, members of the board, Dr. Harvey, thank you very much for having us here today. And I do want to thank the Thurston County Board of Health for recognizing International Transgender Day of Visibility, especially at this time when our community, which comprises about 2% of the population at best, is coming under severe attack from the current regime in Washington, D.C. Now more than ever, we need our allies to not only stand behind us, but to step up and be visible as we have been thrust into visibility. And it's more important than ever that we be seen, that people understand that we are simply human beings trying to live our lives. And I'm on the board of PFLAG Olympia, which is the local chapter of a national organization, the oldest and largest national organization serving LGBTQ plus people, their friends, families, and allies. And we have been lately receiving a lot of contacts from people fleeing from red states that have particularly repressive policies with regarding things like name changes on birth certificates, access to health care, especially for minors, the ability to get a passport with the proper gender marker. We're scrambling to find resources for essentially refugees within our own borders. That we should have come to a crisis like this would have been unimaginable just 10 years ago, but here we are. Among other things, those people are going to need housing, employment, and access to healthcare. And they're coming here because Washington has, a reputation of being very friendly to our community. Quinn, do you wanna?
Yeah, I'll go ahead, yeah.
Yeah.
So first of all, I do want to thank everyone for inviting me to attend today and for proclaiming March 31st International Transgender Day of Visibility. I am here on behalf of the New Boys Club, and my co-admin wasn't able to make it, so we kind of just wrote up something together here. Now more than ever, it is important to be visible. Transgender, non-binary, and intersex people face high rates of discrimination and violence, and that hostility is only continuing to rise. I am here on behalf of the New Boys Club, a peer-led support and discussion group for adults assigned female at birth who identify as transgender or non-binary. Community need for our group and organizations like us has been, and will continue to be, important partly due to ongoing discrimination. The biggest threat recently is discriminatory legislation at the federal level, notably Executive Order 14128, which withdrew federal recognition of transgender, non-binary, and intersex people. Our community faces significant health disparities and has less access to health care. This order impacts our health not just by threatening access to gender-affirming health care, but through redacting research and terminating grants, all because they have keywords relating to LGBTQ plus people. I am grateful to live in Washington State, where Governor Ferguson and Attorney General Brown have made it clear that they will uphold state laws that protect transgender Washingtonians. I am grateful to live in Olympia, which has recently been declared a sanctuary city for the LGBTQ plus community. We do not take these protections for granted, but we also know it is not enough. This proclamation is one step towards a better future, and I hope the beginning of much more work that needs to be done. Thank you for your support.
Thank you.
Thank you. Are there any questions for them or things that you guys would like to say?
I would like to say thank you for coming today. I know the current climate for the transgender community is very tense. A lot of questions about what's coming. I want to thank as well the City of Olympia for the proclamation declaring Olympia as a sanctuary city. I think that that's really powerful to be vocal about the support for the transgender community and the LGBTQ community as a whole. I've recently been having discussions with constituents about this who would like to see the county take a stronger stance on our support for the transgender community. And it's something that people care a lot about. It's something I care a lot about, and I think everyone at this table probably could say the same. So I just want to say, in a time where there's so much uncertainty and there's so much fear, I appreciate you coming here today just to talk to us. And we're here to support, and please reach out if there's anything we can do now or in the future.
Well, we thank you for inviting us. It's good to have an opportunity to connect with our allies in bodies like this that, have some sway in how, what kinds of resources can be marshaled, in support of our community. As I said, we're about 2% of the population. That's not a huge, section of the electorate. So now more than ever, we need our allies, to be standing with us. And we deeply appreciate that this board is willing to visibly stand up and issue this proclamation.
Thank you.
Yes.
So I'm glad to see you today. I'll be glad to see you on the 31st. And every day we pass in town. I'm just I'm glad to celebrate visibility and recognition. And I wanted to plant a seed here. I had a constituent sit down with me who asked, where in government is it decided who can come in and visit somebody if they're in the hospital or they're in jail, or and it's particularly, an issue for LGBTQIA, et cetera, folks, but it's also broadly an issue for platonic friends who've lived together as housemates for years and years, and somebody gets in a car accident. So I don't know I don't know where those rules live, but I just had somebody sit down with me to say that that would be a very important thing for them to address, being able to have somebody important to them be with them if they were hospitalized.
We can capture that question, do some research, and bring
Thank you.
that back.
Thank you. I also want to thank you all for coming today. I mean, we are seeing, we're seeing actions already being taken in our community. And we saw that recently with Tumwater School District at the last Board of Health agenda. We were talking about the mental health impact that this is having on so many of our youth. And so it is very important to be visible and for allies to be visible at this time, because I think if we're not vocal about it, it's so much easier for misinformation to spread. And there is a lot of that going on. And it was very sad to see a lot of that in our community here recently. But I just really want to thank you. You've been great partners for the Board of Health. And we want to be partners too with your organizations and support you as well.
Thank you. We did actually have the chair of the school district, the Tumwater School District, attend our PFLAG meeting on Sunday to kind of counter some of that misinformation and explain, what the vote was and what was going on with that. And our president and secretary are scheduled to meet with the principal of Tumwater High School. So we are very deeply involved in that decision and its repercussions. We're communicating with the GSAs at Tumwater High School and other high schools in the district. And yeah, we are hearing much the same, that young people are, afraid right now, as are, many of their adult peers. But, you can't fight only when it's safe, right? I mean, you have to be willing to stand up even when it's dangerous to do so. Because, that's the way that progress is made. So, you know, some of us are able, I should say, have the privilege of being able to do that, and we're using it. And, you know, again, we deeply appreciate our allies who are willing to stand with us.
Thanks. And I would personally like to thank you as well as aunt of a transgender nephew, who I'm very proud of. And as a pediatrician who knew it would be so controversial to provide health care. And so just know there are a lot of people willing to stand with you and also take some of the flack.
Thanks.
Thank you.
All right, shall we read the proclamation? Willing to start on your end, Commissioner Mensah?
Okay, Thurston County Proclamation, International Transgender Day of Visibility. Whereas International Transgender Day of Visibility was founded in 2009 by US-based transgender activist Rachel Crandall Crocker, Executive Director of Transgender Michigan, to acknowledge and honor the successes achieved by transgender people. And
whereas in Washington State, at least 33,300 adults and 5,000 youth ages 13 to 17 identify as transgender, and
whereas annually, organizations around the world recognize International Transgender Day of Visibility to celebrate the accomplishments and victories of transgender and gender nonconforming people while raising awareness of the work still needed to save transgender lives. And
whereas International Transgender Day of Visibility is intended to recognize and celebrate the work being done by transgender advocacy groups as they fight for dignity and equal rights for members of the transgender community, to build inclusive and healing spaces, and to protect and defend those who are most vulnerable. And
whereas Thurston County recognizes the significant contributions made by transgender people and affirms they are vital members of our community.
Now therefore be it resolved, the Thurston County Board of Health hereby proclaims March 31st as International Transgender Day of Visibility in Thurston County, and urges all residents to celebrate the accomplishments made by transgender and gender nonconforming people while raising awareness of the work that still needs to be done to save transgender lives. Adopted this 11th day of March 2025, Board of Health.
great. public to address the board. So I'll just start by giving sort of guidelines and then we're going to 3 people signed up for comment today. So the Thurston County Board of Health welcomes comments from the public at all meetings. The following are guidelines for public testimony to ensure they are appropriate and do not take advantage of the televised nature of the meeting. All individuals testifying will provide their name and address. Testimony will be addressed to the board, not to the audience, cameras, or staff. Cell phones will be silenced. No response is provided by the board following testimony on a needs basis. The assistant county manager will follow up with specific items. Speakers are limited to a total of 3 minutes. Speaking time may not be shared between individuals. The board reserves the right to restrict an individual's opportunity to address the meeting for good cause. Lewd, offensive, inflammatory, hateful, defamatory, or discriminatory comments will not be allowed. All materials provided to the board may be considered public record and subject to public release upon a request pursuant to the Public Records Act, Chapter 42.56 RCW. No outbursts of any kind. No comments that are commercial in nature, such as promotion of a for-profit business. No remarks about pending land use permits or similar matters that could eventually come before the board on appeal. And the first person that we had sign up was Brett Trowbridge.
There's 12 copies, so we'll take one if you're not a board member. So I'm going to be speaking about what Mr. Whitford here is also going to be speaking about, which is the Lakes Management Consolidated Pesticide Prescription. And what it even acknowledged in there that this is an old thing that was being used last year without you guys even voting on it. So this is kind of an ancient document and perhaps needs a little updating. And I have a suggestion. I want you to understand that there's 3 main reasons why Patterson Lake is different from the other 3. Stewart has them lumped up in here as Offutt Lake, Patterson Lake, Long Lake, and Lake Lawrence. But we're totally different from those. The first reason is that we're in the McAllister Springs geosensitive district, as is Lake St. Clair. None of those other lakes are. So our water goes directly through groundwater to McAllister Springs. Now, we're not talking surface water that flows through Long Lake, Lewis Lake, out Henderson Inlet. We're talking about underground water that flows some east and a little bit north from Patterson Lake and Lake St. Clair into McAllister Springs. Incidentally, the north end of the lake, look at the map as the last thing on your handout, is not in the geosensitive district, and that's because it's in Lacey, and Thurston County can't say too much about Lacey, so this proclamation ends at the railroad tracks, as does the Lacey city limits. So take a look at this map. Here's another reason that why we're so different. It's that properties were left out. They weren't left out on Offutt Lake. They weren't left out on Lake Lawrence. They weren't left out on Long Lake. But for some reason, properties were left out. And take a look now. We're not talking small properties. Some of them are small, but the biggest one here is 40 acres, which belongs to me and my wife. And it's a lily pad wonderland. It's a swamp, now known as a wetland. But I'm sure wanting to preserve it. And I think that since we weren't included, we can't be treated. Obviously, read the statute. Why do you suppose it is that the county commissioners have several times said that all properties were included, asterisk, see enclosed map, and then this is the map, and they aren't all included. So, look which ones we left out. The ones that are the exit stream, these ones here, incredibly swampy, lily pad heaven. That's where the lake drains down towards Long Lake. The 40 acres I was just talking about, lily pad heaven, that belongs to me and my wife. And also the lily pads right under the railroad trestle. So the railroad trestle was left out. And the only reason anybody ever gave was that they were against it from previous iterations. We've had several attempts at this in the past by the same people.
Thank you for the handouts too.
I'm sorry, I can't hear it. Okay, so the third reason is that the bottom of Patterson Lake does not belong to the public.
Mr. Trowbridge, you've reached your time, sir.
You know, I don't understand it. Don't you people want to hear what I think? You do everything you can to cut me off. I at least ask you to read all these materials, especially this one here, that shows in his prescription, he says, well, some of these chemicals are considered passing, some are conditional, and some are failing. So the ones they want to use, endothol and imeprazole, they're in the conditional category. Read it for yourself. They're harmful to human health, one of them. Got a big red sticker on them. So you're going to put that in our drinking water?
Mr. Trowbridge.
So what I suggest is that we add something to this that says we're going to give special care to the McAllister Springs district.
Thank you for coming. All right, our next public commenter is Stephen Albrecht.
Dr. Harvey, members of the Board of Health, my name is Steve Albrecht. I'm a retired family physician. I practiced in Thurston County from 1986 to 2021. And I'm here to plant the seed and get you thinking about a very important bit of work ahead in selecting a new county health officer. Our county health officer who will be coming on board is going to face absolutely unique challenges because my colleagues in the past have had reliable partners at a federal level, but our partners at the federal level now are full of untruths and obfuscations and are unreliable. They are a threat to our health. And we should be seeking a county health officer with high ethical and intellectual rigor so that they can be a reliable local leader. I would encourage you as you work to select a county health officer that you think about how they will work with primary care. For when people can identify a primary care provider, their health outcomes are better. They should be thinking about how they can work with our local hospitals because our local hospitals are part of health systems, and while they are nonprofit in name, their administrators will tell you that without margin, they cannot do their mission, and they will focus on that margin a lot. Our health officers should be ready to call to account how our health systems and hospitals work to improve the health of our community. They should have a very clear strategy, obviously, for improving vaccination rates. Our schools are below the 95% target for herd immunity, and herd immunity protects us all. Unvaccinated individuals are a threat to all our health. Our current Secretary of Health and Human Services pushes untruths about vaccinations, and our new county health officer should be ready to face those challenges. And finally, I would ask you to also have our new county health officer be one who considers environmental health aspects to their job that are not only clean water and sanitary services, but also threats that are looming because of climate change, like flooding and heat emergencies. You have a great challenge ahead. The new person will have great shoes to fill and should be a leader. Thank you for doing the hard work and protecting us all.
And our next person is Barry Halverson.
Good afternoon, Dr. Harvey, commissioners, members of the Board of Health. My name is Barry Halverson. I'm from Yelm, Washington. I'm here today because myself and Doug Carmen from Long Lake were the ones that redid the prescription in November of 2023. The prescription was redone from what Public Works had done previous to that because we added 2 lake management districts, Offutt Lake and Patterson Lake, to the County Lake Management District Core. We also had to update one of the prescriptions because it included Gallium SC, which is one of the things that you would talk about tonight. I was also the representative from the lake management districts that presented the prescription to the PIVMAC in November of 2023. So I'm very well familiar with it. I can here to answer any of your questions. All 5 of the county commissioners that are here today and your county manager last summer took a boat tour with me on Lake Lawrence where I showed them what our problems were, described to them the survey techniques that we use in order to be able to use the chemicals that the county has authorized. And I showed them why we needed to add gallium SC to the toolkit that we need to take care of a very invasive species that is identified as a Class C noxious weed by the state. And that's all in the documentation, in the prescription. I'm not going to belabor that. I just wanted to introduce myself. I have some information with me tonight. I will be here after the meeting if any of you would like to talk to me about it. I would also invite any of you that wants to take a tour of Lake Lawrence to contact me through the county manager or any of the county commissioners or my website, the Lake Lawrence Lake Management District.com, or my YouTube channel, which has got over 70 videos on it that specifically talk about how we can take care of our lakes without using chemicals. It's a very widely used website. There's over 30,000 subscribers to the website right now. So if you want any information about how to better take care of our water, our lakes, or our streams, it's on a YouTube channel for you to take care of. Thank you very much for your attention. I appreciate it. Thank you.
All right, so now we have the team who is going to present the integrated pest management prescription approval process. So we have Kimberly Graham and Stuart Whitford.
All right, so I'm Kimberly Graham. I am supervisor of the Solid and Hazardous Waste Program in Environmental Health and also the IPM coordinator in our department. And
Stuart Whitford, Environmental Health Manager.
PowerPoint to go along with this here. So I'm just going to give you a refresher of what the IPM policy is for the county. Oh, wait, just a sec here. Okay. All right. So what prompted the county to adopt an IPM policy? It is a fairly unique policy for a county to adopt. So really, what prompted that decision? That's the first thing we'll talk about. And then what does the IPM policy mean to us from a practical standpoint? So we have one, but what exactly does that mean? How are the concepts applied? We'll also talk about the active ingredient reviews and how they're used. Then I think you all wanted to know a little bit about Grow Smart, Grow Safe, our website. What is it, who's it for, and how can it be best utilized? Then the role of the Pest and Vegetation Management Advisory Committee and the Board of Health in determining pesticide usage. I'm going to shorten that to the PIVMAC. And then last, Stuart will talk about the Lakes Management Consolidated Prescription. To advance 2 slides, sorry. Okay, so, oh, sorry, go back one. Okay, perfect. All right, so first off, what came about is the public was concerned about the county's use of pesticides. Public concern really started ramping up in the 60s as, research continued and we found out just how dangerous they are. So the county responded by adopting an IPM policy aimed at setting an example through pest and vegetation management programs that, when done correctly, that's the key, when done correctly, actually reduces pesticide use. This policy applies to county property and property managed by the county or contractors hired by the county. Next slide. Okay, we are missing some slides here, so I'm just gonna wing it on these ones. So slide 3. Anyway, I'm sorry about that. So slide 3 was kind of what the rules are, or the requirements rather, of the county entities that have to follow this policy. So departments managing pests or vegetation must develop a written IPM program that's originally approved by the Board of County Commissioners, and then we review it annually at the PIVMAC meetings. A written IPM program must include a description of responsibilities and the properties that are maintained by that program, any operational guidelines and standards, IPM prescriptions and plans, which is why we're here today. So any new prescription must be reviewed and approved prior to use. We don't just go out and willy-nilly throw stuff out in the water or out on the land. And then there's a public notification process for pesticide applications. Let's see if we are missing a slide here. Go back one, I'm sorry. Appears to be missing. Just go ahead and talk about it. Okay, so it's gonna continue on here. All right, so let's talk about an integrated pest management plan. So when developing an IPM program, one must consider elements of an integrated pest management, such as design and understanding pests. You can't treat something that you don't know anything about, and you might in fact actually succeed.
Anything that's required.
To prevent pests to begin with. So if pests have an opportunity to be present, they will be. So take measures in advance to prevent them. Seal off entryways, don't leave food out or anything that's gonna affect them. The saying, an ounce of prevention is worth a pound of cure, really, really rings true to this process. And then monitor for pest activity. So know what your action thresholds are. So an action threshold, this is important, is a point at which pest populations or environmental conditions indicate that pest control action must be taken. So just seeing a pest doesn't always mean that control is needed. The level at which pests become an economic threat, that is when it's critical to guide future pest control decisions. Okay, and then when treatment becomes necessary, so that's when the action threshold has been met and none of your other preventative measures have done any good, then you start looking at chemical controls. So, all right, we're on the right slide there. So only when all of these measures have failed, like I said, use chemical controls. So environmental health reviews all active ingredients in all proposed pesticides and assigns a rating. So they'll be either passed, conditional, or failed. If they're conditional or failed, that's going to require a higher degree of review and approval. Next slide. These were out of order. Okay. So then we're going to go on to Grow Smart, Grow Safe. So Grow Smart, Grow Safe really is a wonderful tool, and it integrates the IPM principles and our active ingredient reviews into a resource that the public worldwide can and does use. There are a ton of great resources on there for natural yard and garden care and pest management. So if you were on the website, we're going to pretend we can see it. If you were on the website and you clicked on the section for weeds, it'll bring up all the different weed control options, and it'll rate or I guess it lists them rather from the ranking of, non-chemical, non-hazardous treatments all the way down to the worst ones. So it gives you a really clear, good idea of what you're working with there. And then also it has a rating separate for whether it's human health hazard, aquatic, pets and wildlife. So if you're worried about one specific aspect, you can choose based upon that. Okay, I'm just gonna use these ones actually. Okay. And then another cool feature of it is within each of those products, there's a link to the product label. So if you click on that, you can go read the label, the label is a law, you have to use pesticides to the label. You can also click on the active ingredients and find our active ingredient reviews and see why we came to the decision of either, passed, conditional, or failed. Okay, and then when it comes to the prescription approvals, so with the prescriptions, we take all that into consideration when someone presents us with a new prescription. One of the county programs presents us with one. And we'll look at it in environmental health first, make a decision on it, maybe some back and forth, and then that will go to the PIVMAC, who will decide whether it's acceptable or not. And then if it meets certain criteria as far as being in a sensitive area, it will come to the Board of Health for review, a meeting like this. So you as the Board of Health, what you're going to be looking at is, has the pest and vegetation problem been assessed and has the action level been met? Is the use of the pesticide necessary? And then is risk to the public health, groundwater, or environment determined to be minimal? So with that, Stuart will talk about the prescription that we brought here.
Thank you, Kimberly. So,
Sorry.
oh, no, this is great. So, and thank you, Mr. for the public comments are very helpful today to put us in context today. So, first of all, the PIVMAC and our IPM policy are very unique, I think, in Washington State. This is an extra level of protection of public health and the environment that you're experiencing today. So this is a good thing. This is a good thing where, Brett can come here, Barry can come here and talk about how do we handle, aquatic weeds in a lake in a safe manner. So in addition to, if we're going to apply aquatic herbicides, they have to be approved at the federal level. Here, we actually have to approve them for use at the local level, which goes through another additional review. So it's actually a really good thing. So this prescription was actually a redo of the prescription that was developed for Long Lake Management District back in the day, because we added 2 lake management districts in the past 2 years. And I'll just read the stated goal of it. Is the goal of this program, is to protect beneficial uses and the natural environment of the lake while maintaining a balance between habitat, water quality, recreational, and aesthetic values. The intention of the program is not to eradicate native plants. It's not to eradicate native plants, but rather to lower excessive and sometimes dangerous plant densities while preserving a healthy ecosystem. I was a triathlete for a number of years, swimming in lakes that had weeds, and part of what can happen is if they're not controlled, swimmers can get tangled up in them, and so, that's one impact, that I experienced, personally getting tangled up in weeds during a triathlon, and so that's so some of the weeds that can get into nuisance levels are big leaf pondweed, narrow leaf pondweed, American waterweed, which is Elodea, water nymph, and the sago pondweed. And there's tons of different, species out there that can grow in a natural way, but then they grow out of control into a nuisance level, and then they need to be controlled. So, as I mentioned, some of the impacts that nuisance levels of weeds can cause are impaired water quality and threats to public safety, reduced or no access to swimming, decreased boating and fishing opportunities, personal watercrafts can be excluded, reduced fish and wildlife habitat, and sometimes unpleasant odors, especially when a lot of times our lakes that have excessive aquatic weeds are also home to a lot of filamentous algae and cyanobacteria, and you can have unpleasant odors from those. The prescription talks about injury levels. Injury level is defined as when vegetation becomes so dense within a few feet of the surface, and when the injury level is reached, that means that recreation such as boating and swimming is no longer safe or feasible. I won't go into all the detail here, just because I know we're close on time. But I wanted to focus on page 4 of the description, which talks about the aquatic weed decision process. So this is a prescription, just like I have a prescription from my doctor. I'm supposed to get medicine. The same thing here. You're supposed to go through this thought process every time. So if you have nuisance species of aquatic weeds that have reached the action level described in table 1.
This is on page 22.
Yeah, page 22, sorry. The treatment options there, as you can see, and this is consistent throughout the prescription, is treatment options that you look at first. Manual control. Hand pulling, can you do that? Is that feasible for the area of an infestation and the size? 2, mechanical harvesting. Is that feasible? Mechanical harvesting has its pros and its cons. Then and only then looking at contact herbicide. Is that going to be the best approach, to control the large area of infestation? And then the last case scenario is the systemic herbicide, which is probably the most effective way to kill off that particular weed, but it's the one that's reserved for the last resort in that thought process. So some of the manual techniques out there, digging and hand pulling, weed blankets, mentioned harvesting, actually harvesting the weeds with a cutter and removing them from the lake altogether. Benefit of that is that you're removing the biomass from the lake and getting it hopefully composted and reused somewhere else. Let's see. Diver dredging, never heard of that. My son is a commercial diver, but this is a process where divers actually hand pull the clumps of weeds, from the sediments, and then they're vacuumed up, essentially. You can imagine how intensive that is from a labor perspective, doing that kind of work. Cultural techniques are big. Prevention is the key. Bottom barriers have been used for years to kind of, keep the weeds beneath the barrier so they're not, they kind of die off that way and they're not impacting your little area for swimming or whatever. Dredging, don't really want to talk about dredging because typically it's just way too expensive and the permits required for it are very hard to get. However, there might be opportunities for very small areas of dredging to occur. And so that's listed as a possibility here as well. Chemical techniques are listed last. Just want to reemphasize that, they're listed last. And basically the message there is that every possible non-herbicide control method has to be evaluated before you turn to a contact herbicide or a systemic herbicide. There's been talk about having glyphosate or Alkamaster, on the list of things that can be used. It's important to recognize that there are documented health effects from glyphosate. We know that from, farm workers in California and other places, primarily because they were not provided adequate protection. They did not have worker safety protections in place. So basically the message is if glyphosate is used according to its label instructions, then it should have no negative impact. And so this prescription, the way this is structured right now is we have contracts with companies that can do mechanical harvesting or herbicide. They're all have the proper licensing and documentation to do this work. Herbicide application is a very careful process because of dilution requirements and things like that, and you have to have very expensive equipment to do that correctly. And also, we sample before and after, to determine if there's any impacts, from it. And just in closing, I wanted to mention again, general methods for selecting control options: prevention, number 1, 2, harvesting, 3, manual control, 4, diver dredging, 5, herbicide application. Do you have any questions?
Any questions? Sorry, looking the wrong way.
Okay, so this series of steps that you outlined several times, given that we've got this kind of we're calling it a consolidated prescription, so it's a scheme that applies. But as to any individual lake or situation, how is the county monitoring that all those steps were made?
Yeah, so basically Lawrence Lake and Long Lake already have integrated aquatic vegetation management plans in place, so they are following those plans. They'll probably be updated. They were done, some years ago, but they're still applicable. And also right now we have state grants that are funding the development of plans for Pattison and Offutt. So all of this will be, codified, is basically codified in those plans, essentially. So it's kind of a wraparound process to make sure, that we're all doing the right thing. And I know from experience, only 1 year of experience being part of this program, is that the LMDs, Barry and then Doug are very hard on their contractors and making sure that whatever monitoring data is required is being done and submitted, and they're dotting the I's and crossing their T's to make sure that it's done right.
On all the, you were going through all the different non-chemical techniques. Is aeration ever, I've met with many citizens and many hours. One of the folks, I think from Offutt Lake, was saying that, providing me some articles about use of aeration to control toxic algae. And I was just curious if you've seen that, considered it, know anything about it?
So I think the idea behind that is what you're trying to do is create you have organisms that are competing for dominance, in a lake or stream, whatever. And so in cases where cyanobacteria is dominant, there are ways to try to push other, like just green algae into more of a dominant phase. But I don't know enough about it to know if that's something that should be, it might have some positives for algae, but probably not so much, aquatic weeds, which is the subject of this. But I just don't know enough about it, but I've heard about it for sure.
Where I came from, in an alpine lake, we used aeration for the algae, but it would not address the weeds.
Yeah, it's an algae
Yeah,
technique, really.
because what it does is you're trying to disrupt the ecosystem by which it grows through natural circulation. But you'd have to buy significant pumps.
To make it work, you gotta have sufficient horsepower to make that work.
Two more. The next question I had was about the McAllister Springs geologic sensitive area that Mr. Trowbridge brought forward, and he brought that forward at the time that we approved the IVAMP development, and I don't know. So I guess my question is, this is a consolidated plan that incorporates the lakes. He made the point today that, Patterson's different, and he is right in the sense that it has that connectivity with McAllister Springs. So is there anything about that connectivity or that being in the geological sensitive area that bears on this consolidated lakes prescription and justifies, a different approach?
I just, based on my experience and reviewing all the documentation and science that I know, as long as this is done right and we don't have spills, there should not be a problem. And, but there's always a possibility, whatever we're doing, sewage spills or oil spills, there's always a measurable probability that could occur. But unless that occurs, I don't see a significant impact on McAllister Springs.
Finally, I wanted to ask about cost, because you alluded to this, but some of the techniques that are non-chemical are really labor intensive and really expensive. So I'm just wondering, to what extent are decision points turning on that? Because, the public might like to think we have unlimited funds and we're doing the absolute most environmental friendly thing in every instance. But when I've sat through some of the presentations from the contractors to Offutt Lake on their IVAMP, and there were decisions to be made where, they're contributing money, they have a limited budget. This thing might work, but this other thing is, I'm gonna be perfectly honest for those that haven't sat through all of this stuff that the board has, but the chemical techniques tend to be way, way cheaper. And so, if they're safe, that's great, maybe that's the right choice. But I guess I'm just wanting you to maybe talk a little bit more about that, because, you're talking about, well, we walk through this thing and we always do the easiest thing, but sometimes I think, I'm not being critical, but sometimes legitimately choices have to be made to do something that might be a little bit riskier because it's 1,000 times cheaper. I'm just wondering, the public needs to be aware of that when we're laying this out about how we do it and the way we do it. So is there any more you could sort of talk about that?
Well, I guess that's one of the reasons that, having lake management districts, having the county be the fiduciary of it, puts us in a role where we can make sure that those alternatives are always being looked at. Now, when you talk about Long and Lawrence, they've been doing this for a number of years. And what you see in here is a lot of experience that's been gained about certain processes, procedures, techniques they've used in the past that have worked or haven't worked. And in some cases, it's been discovered that maybe something doesn't work that well, or it's just too too expensive, or we can't get a contractor to do that. That's something that we should be aware of and have a heightened understanding of, to make sure. But for example, recently we Jen and I just put a purchase order for harvesting and cleanup of Lorna Canal and Long Lake, which is going to be a mechanical process. Because of the nature of that canal, mechanical process works best. So it's not like they're out there just applying herbicides because it's the easiest or cheapest. Whenever there is an opportunity where mechanical makes the most sense, that's what's most likely going to be done. But if you're talking about large areas of invasive weeds, then you're right, Normally in those cases, the appropriate aquatic herbicide is the one that may be chosen as a balance between, to make things work in the most efficient manner.
Student, aren't you working with the budget of the assessment of the property owners around
Yeah.
the lake? And so that's part of, the county isn't the one setting the fiscal limitations. Those realities are set by what they've agreed to assess themselves.
Yeah.
And pay for. And so to Commissioner Menser's point, it's that segue between what is cost effective and what the budget is and what's gonna get the job done. And you're evaluating what's the best case scenario. And you just mentioned that in some cases, mechanical treatment was more.
Is the preferred option, because,
Comment on that. On page 4 of what he's presenting, they compare mechanical harvesting at 1,500 to 2,000 an acre. Contact herbicides, 1,200 to 1,500 an acre.
Mr. Trowbridge, we're not accepting comments at this time.
Systemic herbicides, 1,400 to 1,500 an acre. So if you'd read it, give you an.
All right, Councilman Gilman.
Thanks. I've come late, so I haven't had all the commission's work on this or your December briefing. But my first big question is about, I understand we're calling it an integrated pest management plan. But in terms of implementation, how much is prevention, harvesting, manual control, and how much is application of herbicides in these lakes over the last few years?
Well, I'm new to the program too, so I don't have those specifics, but I do know that Lawrence and Long apply. If you read through this, a lot of what is presented here is lived lessons of what worked and what did not work, for those lakes way back, back in the day. I don't want to say back in the day, but years ago. So this does reflect the experience of others that have tried different things over the years and found out, oh, this works good, or this works good, but it's so expensive, or we can't, like I said, we can't get a contractor. But my job as the point of contact is to ensure that we're always going through this thought process. And so my job is to question, like when I review the new aquatic vegetation management plans, I will have questions about that and suggestions maybe on how to improve those things. And then the same is, it's just like, it's a back and forth with the steering committees, lake management districts. I pay an invoice, I'm gonna pay an invoice, I submit the invoices to them for review. They may question the invoice and cause me to, disallow a cost or so, so that's the way we work.
And I want to make sure I'm not misunderstanding, the herbicides that we're using, are those biological agents?
No.
But they're not, so they're
chemical.
So it is chemical agents, so I guess I would see that as, that's a decision tree point where you stop doing IPM and instead you revert to chemical control. So I just wanted to get that clear in my head.
Yeah.
And then I'm curious about Mr. Trowbridge's map and the parcels, both some public and private parcels that aren't shaded in. What is the understanding of applying to the whole lake? And what does that mean, that shading in the map?
Okay. Go ahead. Do you want me to reply now?
We can gather that and put that into a report and reply to that.
That's fine.
Yeah.
Thank you. Thank you. All right.
So, I guess what I would like is, so if we move to approve the consolidated prescription, I would like to know exactly what that means. So does that mean we are saying we're just talking about the herbicide that is approved, or are we talking about this whole plan?
The whole process.
So
that is.
the whole description of how the approach is from the least chemical to the, okay.
Yeah, and again, just as I mentioned, with Long and Lawrence having been doing this for so many years, a lot of that, is in here, and so the idea is, with the information presented, we're hopeful that you'll support this, going forward. Obviously, plan, do, check, act, so if we need to make, adjustments, based on monitoring data or what have you, then we can do that. That's kind of what we're asking is, so the PIVMAC said, we're okay with this, just like they did the original one for Long and Lawrence. And that's what we're asking. Do you believe that this prescription will mitigate the risk enough to allow these weeds to be controlled in the ways that this dictates?
Stuart, can you talk about the PIVMAC and kind of explain what it is and how many members are involved?
We have 9 members of the PIVMAC, and it's comprised of, we have people with environmental interest, agricultural interest, and the general public. And right now, we do have a toxicologist within the PIVMAC. So, I mean, there's a wealth of education and experience that goes into these thought processes.
All right, any final questions or comments? All right, so I'll take a motion to approve the consolidated prescription.
I move to approve the consolidated prescription.
A second. All right, all in favor?
Aye.
Any abstaining?
Abstaining.
Okay, and any opposed? Okay, thanks. And the next things on our agenda are 2 public hearings.
Starting on page 50 of your packet.
And I will do sort of a preamble that will apply to both public hearings.
Chair, just for the record, that motion passed. Great.
Yes, the motion passed.
So you did say.
Oh, okay, so sorry.
No problem.
I know I can visually see, I forget that not everyone can see it. All right, so for public hearing, purpose and instructions. The purpose of this public hearing is to accept and consider public comment related to the sanitary code for Thurston County Articles 1 and 4 revision. Article 4 regulates the permitting, installation, and long-term operation and maintenance of on-site sewage systems within the county. And then the second will be on the update of environmental health fee schedule per RCW 70.05.060. Any decision related to the setting or modification of fees may only be determined by the city and county elected officials on the board. So the hybrid public hearing, this is a hybrid public hearing. Those wishing to testify have joined by Zoom, emailed, or mailed in their comments, or appeared in person. If anyone viewing online wishes to testify, please visit the Thurston County homepage online and select BOCC meetings, hearings, and work sessions, and navigate down to the Board of Health meeting Zoom link. And do you want to describe how it will proceed?
I'll turn it over to them.
Okay.
So I'm just gonna do something. Oh, perfect. Thank you so much. Appreciate that. Season Long, Environmental Health Division Director. So we first introduced Article 4 to the board in December and then updated you in January on our progress. The full revision timeline is included in your packet for reference on page 30. Today we are here requesting a motion to approve ordinance H-3-2025 to adopt revised Article 4 and Article 1. The ordinance is included on page 34 and identifies the primary updates with the revised codes. And I'm going to turn it over to Dawn to talk about the summary of changes for Article 4.
Good afternoon, Dawn Peebles, Environmental Health Program Manager. In your packets today is included the summary of changes to Article 4 for informational purposes, which can be found on page 38. The primary changes include removing the state code language, clarifying details, and adding current policies and procedures. This document also includes revisions based on the comments received from the public and septic system professionals. 2 items to note include a minor revision to clarify language of item number 44 on page 43 in the summary of changes, and retaining our current renewal dates for our septic system professionals, both of which will be reflected in the adopted code. We also have in your packet the summary of changes to Article 1. That is on page 49. These changes are primarily a result of the Article 4 update and the reference to the code sections. It does also include an update to the definition section to reflect the change in the recently adopted hearing officer resolution H1 2025.
I'll be happy to answer
Answer any
any questions.
questions?
Any questions or? No? All right. So, guess with that, I don't have a lot of questions.
Great.
So, we will, accept a motion to approve the revision of the Thurston County Sanitary Code Articles 1 and 4 and adopt resolution H3 2025.
Public hearing, so we have to allow public comment.
Oh, is there any public comment that was signed up or? Okay, sorry, I didn't see any, but okay, thank you. All right, so I am open for that motion.
You have to close the public hearing?
Close the public comment. I would
Okay.
move to close the public hearing.
Second.
Second.
All right. All in favor?
Aye.
All right, everyone's in favor, no opposed, no abstaining. All right, everyone's in favor. Now I will accept a motion. So,
I would move to approve revision of Thurston County Sanitary Code Articles 1 and 4 and adopt resolution H2 2025. That's
Second.
is it H3 or H2?
H3.
H3 2020.
Sorry, there was a typo here from H3. Sorry.
Is there a second?
Second. Oh, Commissioner
Oh,
Fournier.
Commissioner Fournier, okay. All right, all in favor?
Aye.
Aye.
Any opposed? None abstaining? All right, the motion passes. Now we will move to our second public hearing. The hearing is now open, I guess.
We gotta get you a little, hook her up, Commissioner McGinnis.
I'm looking for it.
It's like Thor's hammer right there.
Yes.
Just once.
Oh, no. All right, so should we have Susan present again, or? All right.
Today we are here requesting a motion to approve ordinance H-2-2025 to adopt revised Article 1, Appendix A, Environmental Health Fee Schedule. The updated fee schedule summary of changes is included in your packet on page 52 for reference. I would like to note that on section 2 of the ordinance identifies it shall take effect immediately upon adoption. Knowing that we have to update the fees and that IT is gonna take a little time to do that, we would like to propose an April 1st, 2025 adoption date, which will be reflected in the adopted ordinance, which will be provided to you for signature later this week. I'll just give it to Dawn to do the
Yes.
summary of changes.
And included in your packet is, or the summary of changes, which identifies what we're changing on the fee schedule itself, including adding 2 new fee descriptions, reducing fees for subdivision applications, reducing all land use fees to reflect the current hourly rate, increasing solid waste permit fees by $5 to $15 to also reflect the current hourly rate, clarifying fee language and removing an obsolete fee.
Answer questions. Are there any questions?
Sorry, did you say, just to clarify, I was reading and listening and I didn't catch if you said you're requesting for us to have this motion in April?
Effective April 1st
Oh,
instead of
okay.
immediately. Yes,
Okay.
please.
Are there any public comments or people on for questions? No? No? No one said anything? All right, so I guess we call the public meeting to an end then? All right,
I would move to close the public hearing.
Second.
all in favor?
Aye.
And any opposed? Nope. All right. We're done. All right, so now, we, I guess have only members of the board vote, right? An official.
Need a motion? I move to approve and adopt updated environmental health fee schedule.
A second? Oh, sorry, I'll second.
All right, all those who can vote in favor?
Aye.
And it sounds like no opposed. All right, so the motion passes. Thank you.
Now that those have passed, I will pass this around for signature.
Thank you.
There's two places.
All right. And now we will have a presentation from EMS from Ben Miller-Todd. Thank you for coming.
Absolutely. Thank you very much for having me. My name is Ben Miller-Todd. I'm the Director of Emergency Services for Thurston County, overseeing Medic 1 and Emergency Management. By and large, we're going to be talking Medic 1 today, just to set the framework here. This is a little bit of a follow-up from our presentation in April of last year. It's really to talk through some of the initiatives that we had said we're going to do and really follow up on what are we actually doing. So this should be fairly succinct in terms of that report moving forward. I could probably stop right here in saying we did what we said we're gonna do in 2024, but I'll go through it in a little bit more detail. With that, I'm gonna switch to the next slide, please. Part of the rundown in this, and just to show you how we kind of frame this, everything in green is what you would expect. Everything green is go. Everything in an orange color, yellow color is that it's in progress. One of these components that I did want to hold kind of up is that we're in the process of board approval and really messaging and communication with our comprehensive plan to really take a look at how we holistically serve and integrate with not only EMS, but looking at healthcare in general. And so that's a big piece of some of those transitions that are coming forward. Additionally, we are constantly struggling, as anybody in healthcare feels, with healthcare shortages. Paramedic shortages and staffing are a consistent concern of ours. And so those will perpetually be highlighted in kind of an amber color as we move forward. Hopefully that comprehensive plan turns to green here by the time we enter into quarter 3. The other couple components that I wanted to pass on are that we have initiated into a contract for the 8th Medic Unit with the City of Tumwater. They have achieved a staffing level to actually implement that. Our anticipated implementation date is January 1st, 2026, with an understanding that that may come earlier than later because of the staffing capable of doing that. So we may have a possible quarter 4 start on that unit. So in terms of successes, we take that as a big success. Lastly, and what was the high point of our discussion last time were all of the opioid, I would say, components that we're looking to address. And so holistically, we are in the final stages of approval. Keep in mind, we're a month ahead of where we were last time. We're in the final stages of approval of our protocols with the state of Washington for leave-behind Narcan, for BLS Narcan, as well as Suboxone. The state recently, as of March 4th, actually just after I submitted this, has approved our pilot process for buprenorphine or Suboxone. They are 2 separate medications, but I'll use Suboxone by and large for the initiative that we're going to be using. It's a combination of buprenorphine and naloxone into one medication, just so you're aware. So Suboxone is what's going to be used in the pre-hospital setting throughout Thurston County and all of our paramedic units. And I get the pleasure of calling out some really key partners. Katie Strozik has been an excellent partner as we've gone through navigating all the different components that are really outside of EMS's realm. This is a new realm, a new bridge as we look to bring down those silos and bring down those barriers, but we needed kind of a help. I'd say somebody to help usher us through that, and she's been an excellent individual to have involved with that, as well as helping to review our protocols. and been involved in some of those components. Additionally, I want to call out our partnership, and this is kind of one of those late breaking ones. It came in really late Q4, early Q1 this year, in terms of Catholic Community Services has come to the table with a peer case manager. And so there is a gap involved when you're looking at recovery services that is the 2 a.m. call for EMS to a clinic that's open during business hours and a lot of time limited. And that gap is how do we get the individual that we would like to help towards recovery services, whatever that looks like, whether it's Suboxone or any other initiative, to being able to achieve really getting and accessing those resources succinctly. Catholic Community Services came to the table and said, hey, we have some grant funding that's not federally allocated for a peer case manager. And they're filling that gap as we go through this, and we'll talk about that in terms of really creating a partnership between government, nonprofit, and really looking at what that looks like to help better support our community. And so those are some of those key pieces that we wanted to call out in terms of those partnerships. The next few slides are just going to be walking through that. If we go to the next slide, we talked about all the different components associated with opioids or opioid use disorder that we were doing. Again, I just highlighted some of those key components. Approval process for the protocols we anticipate within the week, fully incorporated, and then deployment would be between April 1st and May 1st. We're currently in the process of training that. And so we're just ahead of being able to put them all as green. But we're just about there. Next slide. This is just talking a little bit about what opioid use looks like in Thurston County. When we look at a county-wide perspective, this is a very broad heat map in terms of where we are responding to those calls, just so you have a little bit of awareness, what our total volume is within a year. We run about 2 calls per day when you're looking at some of the components associated with our figures in terms of the responses we're having. And this is just very broad on what we're looking for the impact. So when we look at a county-wide deployment for a paramedic level Suboxone, our paramedic level deployments are truly countywide and soon to be 8 medic units. And so that covers 100% of our patient population within Thurston County. And that's what we wanted to achieve. That's why we placed it where we did. This is just a little bit of a breakdown. This is just an awareness of where we're responding, how we're responding, what the population is we're responding to, as well as some of the chief complaints that are associated with those calls. I won't go through all the different details in terms of the breakdown, but I think the point here is that it's a fairly universal problem. When you're looking at age distribution, when you're looking at chief complaints, when you're looking at the number of doses that we give, this isn't just a specific segment that we can say it's affecting. It's pretty broadly, pretty universal. Next slide. This is the number of doses that we're administering, just for your awareness. It's split basically 50-50 between 1 dose or greater than 1 dose. We didn't break it down beyond that. And then also when I point out why we have the initiative the way we do, the distribution of the times that we respond to calls and the volume is also involved in that last slide. As a last piece, this is that partnership. This is the anticipated flow through that referral process that we're looking to create those partnerships and build those relationships. And this is a key piece. That key peer case manager is really key to making Thurston County truly different than programs in Seattle, King County, Spokane, and others. Is really creating that link from the field, specific dedicated link from the field into clinics. With that, I'll open it up for any, the last little bit is just a little bit of supporting information in terms of the process so that you can read through it. It's a software we'll be using for a HIPAA compliant case management software. So we're making sure we're managing those records in a safe and confidential manner between new partners outside of the ER for EMS. And the last 2 are supporting documentation for, the last 2 slides are supporting documentation for the why. And so with that, any questions you have, I'd be happy to answer.
Wayne's got his hand up.
Okay, Commissioner Fournier.
Yeah, I just wanted to, I guess, echo what Ben said or thank Ben for what he was saying, because I want everybody to really understand that what he is saying they have done is truly progressive, and it is really forward leaning to have, to not just administer the Narcan, but to actually have the follow up, to have the leave at home Suboxone. That is not the model everywhere else. That is really ahead of everyone else, and it's really something we should be proud of. And again, this is our number 1 cause of death in Thurston County, premature death, I think. So it's a big deal. So what they've sculpted here is very impressive, and we should be very proud of it. And I thank you, Ben, for presenting this and putting this together.
Yeah, Ben.
A team. It's a big team. So thank you.
Just to add, yeah. Congratulations on the use of peers. I think that's very, very progressive and very smart. If there's a person who can help a person in the middle of the night go from that dark moment of use to actually engaging in treatment, it is a person who has been there and done that. So, excellent work. Thank you.
That was an incredible addition by Catholic Community Services to come to the table and say, hey, we can help fit this niche. And so that's been incredible. So.
Just a short question. The Suboxone administered by the first responders, I'm not familiar with that. What is the function of that?
Yeah, so in large part, I'm gonna not go into the weeds. I'm telling myself that now.
So I understand when it's like at the boot clinic, long-term, like methadone.
Yep.
And I understand Narcan, but I don't understand what the function is of giving them the dose on the way to the hospital.
The short answer to that is mortality reduction. And so
That's a good reason.
Suboxone or buprenorphine itself is actually a scheduled medication. It binds to the same receptor, but it has a much higher affinity than even naloxone. And it binds and holds. Its half-life is extremely long. But ultimately what it does is it binds and holds to those receptors and doesn't allow anything on those receptors for an extended period of time. So therefore you cannot then, if you were to have fentanyl or carfentanil or any of these other drugs subsequent to that, you can't replace it. So therefore it goes through your system, it's metabolized, but it's not activated. I'll use a simplistic view of this. It's far more complicated than that, but it isn't allowed to actually bind and create the conditions of respiratory distress and respiratory failure that cause the mortality associated with opioids.
Thank you, Ben.
Yeah.
I feel like you've described Gelada to me before, but I'm looking at the slide and I don't quite get what it's doing. Can you talk a little more about it?
Yeah, absolutely. So the mess of connections and nodes that you see in the picture is really the point. Is that healthcare is very complex and it has a bunch of different nodes and every individual has the support that they need, or has their own unique needs, I will say. What Gelada does is help to create a HIPAA compliant environment where EMS contacts in the field that happen at 2 o'clock in the morning can be referred directly from that environment to whatever resources they need. So as we make connections and as we create those connections between partners, Catholic Community Services uses Gelada, which is going to be the referral site for the peer case manager, that we can now refer directly from our charting software in the field at 2 in the morning and literally hit a referral button that sends it and allows that case with the patient's permission to be sent to Catholic Community Services or to be coordinated with public health or to be coordinated with any of our other support service programs throughout our EMS agencies. So that's what Gelada does, is really create that framework that exists for EMS between EMS and an ER, but healthcare doesn't exist in that linear fashion. And sometimes we need to have a variety of different arenas available to us or connections to be made in a software compliant environment, HIPAA compliant environment to pass along those records so that we can better serve the residents of Thurston County. This is also a required program by the LEAD program already within Thurston County. And so there's already a contract currently in place. For that, we're expanding out those components.
Do you want to say something?
Oh, I would like Commissioner Grant to speak. Oh, okay. Anyway, as most of you saw, I'm over here weeping because this is such important work. So I can't. It's okay for me to feel feelings, and to be able to recognize how important this work is in Thurston County, and that 1 to 2 people are dying a week. I just want to say this is what real impact looks like, so thank you. It's groundbreaking and leading, and, we talk a lot about, what you need in a crisis, and opioid addiction is a crisis, and you need somewhere to go and someone to follow up. So this collaboration with
Catholic Community Services, and a peer who can, has lived experience in dealing with overdose and dealing with being a person who has actually experienced that moment in time, is going to be so valuable. And so thank you so much. This is just incredible work.
Absolutely.
It's an amazing amount of work in a year.
Again, partnerships.
It's impressive. As a person who's lost two of my most favorite patients in the whole world to this, it's very important.
Told you to keep it to 10 minutes.
Good job.
Well done.
Thank you very much.
Well done. And then the health officer, department director, we figured you could read unless there were any other questions or comments on that. And it's still flu. And there was a measles in Seattle. It's gonna be an adventure. So. And then subcommittee, sounds like education outreach and data did not meet, but policy did. So I don't know if you had anything you wanted to summarize or.
Sure. We had, we got some input on kind of, we had questions about sort of the jurisdiction of the Board of Health vis-a-vis topics that are more social service oriented and that flow into regional housing council work and cities work. So we're gonna have a kind of a follow-up on that, discussion on that at the next meeting. We spent the bulk of the time with a presentation from staff, kind of going through the history of the policies related to septic compliance and what some of the options look like, what some of the other counties are doing, and getting input from the subcommittee on what types of proposals we'd like to see developed for consideration of the Board of Health and the subcommittee. So we kind of gave them, no one was available on this regularly scheduled April. I think we're gonna have a follow-up meeting on April 11th, but we gave the staff until the May 2nd meeting to present some of the possible ideas, things they've been working on for years. So it's not like they're lifting this out of nothing, but to kind of pull together some specifics based on the comments they got from the subcommittee, and then we'll talk about those in May. Long and short of it.
So do you wanna give the update on the?
Sure, I can just jump to the part of, so I know you all requested last fall for this open Board of Health discussion and information sharing. And I would like to provide some structure to that, so that it's not just open discussion. So my request would be that at least 2 to 3 weeks before the next Board of Health meeting, if you have bullet points to talk about, we can include those in the agenda. So please do think ahead and get to me any ideas before the next meeting's open discussion. That way it's a little more structured open discussion. So thank you. And then we did have updates from the last meeting about some potential letter writing that we were talking about, so.
Yeah, do either of you wanna update on the letter writing or?
Do you wanna go first, Commissioner Mejia?
Oh, sure.
So at the last meeting, we talked about maybe having a Board of Health letter for the NACO conference, since I am on the National Association of Hispanic County Officials. We had a meeting with the group before the NACO conference, and I brought up the proposal of having a letter, and it was suggested at that point not to have it, so that's why there wasn't a letter that was sent around. If I can give an update on kind of how that went, is that okay? Does that still fit the boundaries? And so with the National Association of Hispanic County Officials, we proposed 4 resolutions in regards to immigration and the Human Services Committee. We were able to pass 4 of them. And we proposed a discrimination one based on the executive order that was rescinded. That was from Johnson, Wayne?
Correct.
I was saying Eisenhower and I was completely wrong. And Commissioner Fournier was kind enough to correct me. That unfortunately, it went through the committee, but it did not pass through the Board of Directors. So those four resolutions will be kind of going in for the main NACO meeting to be voted on. And so it was very exciting that they at least got through that first gap. In terms of advocating, I went to different, I can give a whole list of the people I had the opportunity to visit, and I dragged Commissioner Fournier to some of them. I met with, let's see, Congressman Richie Torres from New York, staff from Congressman Ocasio-Cortez from New York, Congressman Jim Costa from California, Congressman Vicente Gonzalez from Texas, Congresswoman Delia Ramirez from Illinois, Congresswoman Diaz-Balart from Florida, and Congressman Pete Aguilar from San Bernardino, California. And our agenda consisted of course, immigration, access to healthcare, environmental justice, and behavioral and mental health. And it was interesting to hear back that perspective from different congresspeople, and congresspeople were both leaning, they were both Democrat and Republicans that we visited. And there was an overall support, but then there was also there was not, you could tell that there wasn't a lot of communication right now between the legislative body and the executive body. And so there wasn't clear guidance or clear direction that they could afford us or give us. And so basically, you know, the fight is going to start to have to continue at the local level in terms of all those different aspects. But that's just kind of the whole report out of, I appreciate the suggestion of the letter, but just how it was laid out, it wasn't necessary at that time.
Thanks for all that work. A lot of people to meet with. Great. Would you like to update yours? Or?
Yeah, so I appreciate that update from Commissioner Mejia. So when we discussed this at the last meeting, my plan was to kind of use the draft letter for the federal representatives to kind of draft one for statewide action. And Jen and I, Dr. Farhat and I emailed a little bit about this, and since there wasn't an example letter for the NACO conference, because of the reasons Commissioner Mejia mentioned, I just received a starting point letter from staff a few days ago, and I think it's a really great starting point, and I'm working on implementing specific actions that we can advocate for at the statewide level. But unfortunately, a lot of the bills that I was following related to support for immigrants and refugees in our state have already died. So I was particularly following the wage replacement program bills, which they're not going through anymore. And I'm right now, it looks like one of the main priorities that's still, we can still advocate for is the Apple Health expansion and immigrant health programs. And so I'm kind of wondering, since the Board of Health, that's really relevant to the work we do. And if there's an appetite for a letter from the Board of Health to the state, I'd be happy to draft one. But I just kind of wanted to get direction from the Board of Health on what topics you're interested in having covered in that letter. And there's a couple, so just a quick bullet point list. I think the Apple Health expansion one is the most relevant. There's also the Washington Migrant and Asylum Seeker Support legislation, or Washington MASS, M-A-S-S is the acronym. Legal aid for low-income immigrants, and that's part of the State Legal Defense Fund. And then there's naturalization and citizenship funding and community defense support. So I'm happy to keep it simple if we want to just like have a letter drafted for requesting the Apple Health expansion. I'd be happy to put that in there and just kind of keep it simple and forward it on through staff to get to the full Board of Health. Does anyone have any thoughts on any of that?
I agree. I think that's the fight, is to hold on to the Apple Health first. The rest of it's all nice to have, but.
And did I hear you say expansion of the immigrant health piece of that, yeah, I would be so much in support of that. You know, in schools, we have young people who lose apple health at the age of 19, and
Right.
for
Yeah.
undocumented young people, there's no option.
Exactly, yeah, I appreciate
Very
that.
much be in support of that.
And
Thank you.
50% of kids in our county are on Medicaid.
Right.
I will just add from the public health department perspective, the Medicaid issue is our largest concern.
Yeah, okay.
So I think
I
it sounds like,
support that.
it sounds like there's consensus. Is there any
looking
concern
like
with
it.
that? Nope, I think we're all in favor of writing a letter.
Okay, perfect. So I'll get working on that. I can get it done pretty quickly because thanks to Dr. Fryhead, I already have a solid starting point, so I'll just put that in there. And because things move so fast in the legislature, how should I get this letter around, and are people comfortable with electronic signatures if it's passed around before the next Board of Health meeting, or how exactly should we do that?
We have to be mindful not to create a serial meeting. So that's something that we can probably talk about. I know Amy Davis, clerk of the board, got some guidance about that approach, but we can inform the process on what's the best way to do that.
Okay, that'd be great. My only concern, which maybe we can figure out between now and the next meeting, is if we were to have a concern about serial meetings, I don't know that asking for this, I think that we would have to do it pretty quickly just because of how fast things move. So, yeah, if we have to like wait till next month, it might be too late. And Commissioner Fornieres. Maybe Commissioner Fornieres.
I just want to, like, anything that's going to go out as a action of the board, as like a consensus of the board, it's got to be decided on in this boardroom. And it has to be agendized, and then there has to be, because that's a final action going out, you've got to have an opportunity for public comment. So it's got to be posted, it's got to be viewable by the public for at least 24 hours on the agenda. And there has to be an opportunity for that, otherwise you're going to run into this problem.
Okay, thank you. Would it be appropriate to have maybe like the chair and vice chair sign off on a letter? That's what we do through the Regional Housing Council sometimes, where staff will write a letter and then just send it to the chair and vice chair to sign off on it. So would that be something I would make a motion on? Would that be the most appropriate course of action?
In this situation, I would
Okay.
be supportive of that.
Okay, well then if I can, then I would make a motion to allow me to draft a letter working with staff to support healthcare access expansion for immigrants and authorize the chair and vice chair of the Board of Health to sign that letter.
Second.
Okay, all in favor?
Aye.
Any opposed?
Great,
Sounds good.
thank you. I appreciate that.
Thank you for doing that.
Yeah, thank you so much for the support. It really does mean a lot. I think this is very important, and it'll really be good for us to take a strong and vocal stance in support of this. So I appreciate that.
All right, I think we have made it to the end of the agenda. So does anyone want to make a motion to end our meeting?
It's a non-debatable motion. So moved.
Second.
All in favor of adjourning our meeting? Aye. No opposed. It passes.
I was hoping Wayne was gonna jump in.